Hi, this is Vicki Haines from Atomic Dermatology. I'm here with Dr. Shawn Horn from Spokane. She came up to use our Softwave today, and I'm just going to do a little interview with her, ask her a few questions. Tell me about your skincare regimen. Tell me about what you've done with your skin so far.
I am originally from Southern California, so I've had a lifetime of being in the sun, but I was very fortunate in having a mother who really prioritized skincare. So starting at a very early age, I prioritized sunblock, moisturizer, and started having facials and things like that as a teen. In my early days, before I became a psychologist, I did model as a teenager in LA. And so skincare was really important to keep yourself looking fresh, youthful, vivacious, a good glow, all those kinds of things. So over the years, I've just had that be my main focus, but I've been pretty conservative about doing more aggressive kind of interventions. I am 52 now, and so I have explored Botox when I was, too early. Like, why did I do it in my mid-30s? I do not know why, but now I haven't done it in maybe 10 years or so. But I do a lot of public speaking, and my eyebrows have a life of their own. So I've been kind of exploring about a way to tame that down, but yet I've heard a lot of people say that they like that aspect of things. So I haven't done any fillers, I haven't done any injections, except for exploring Botox earlier in my life. And I have done IPLs because of the sun damage. Love that, was so happy with the results because I do have rosacea. So the redness, the sun damage, and things.
Softwave, it is not going to worry about the texture of your skin. What Softwave does is it actually uses ultrasound therapy to rebuild that collagen and the elastin. The elastin is the basement membrane, and so it'll rebuild that so that we can plump back up, and like she mentioned, bring those eyebrows up and rebuild that collagen so that we can keep a youthful glow without looking, artificial or weird, because it's our own skin that's regrowing, our own collagen that's regrowing. And so what about Softwave sounded great to you?
There's so much skincare stuff out there right now that everyone's promoting.
Absolutely.
And what I think a lot of people don't realize is that if you just go to your dermatologist, you get rapid results, much quicker, that are more longer lasting, and you actually end up being more cost effective. People don't think that. They think a lot of these treatments, like, why am I going to spend $300, $500 on that? Well, you can buy the skincare that's going to take away your wrinkles, and you're spending hundreds of dollars every month getting the best of the best, when you can go to the doctor and just right then, right there, get it resolved.
Yes.
So I think that I have become a fan of some of the more going to a professional, going to a dermatologist, having them do something that is going to help from the inside out. It's going to give you more of those longer lasting results than just exploring all these different lotions and ointments and things that, or taking a collagen. That's a big thing right now, right? Taking the collagen supplements to help.
It is. And that's kind of one of those catchwords with collagen. It's like they think that they're going to drink something and it's going to go into their skin. That's just not how it works. Collagen is rebuilt with energy. Energy causing, whether it's, or injury, I should say. So, whether it's a skin peel or an IPL or Softwave, that's once the body sees that there's an injury, then it calls your little fighter pilots in there, says rebuild, rebuild. And that's how we rebuild collagen. Those are our little building blocks. And so that's really what this is doing also. So Softwave is kind of the newer technology of a little faster results, but it does take time for our body to rebuild collagen. So it's not instantaneous. We'll notice, at 1 month, 2 month, 3 month, all the way out to 6 months that your skin gets nicer and nicer. So it's kind of reverse aging. So kind of a cool thing. And it's something you can do every year. Once a year, you come in here, 30 minutes, boom.
And I know that you want to start this stuff early, so it's kind of preventative.
Absolutely.
Because if you get ahead of it, you can keep a lot of wrinkles from forming and things. But stuff that a lot of people don't even think about, that you become conscious of as you start to mature, when your eyes start to droop, and it makes you feel a heaviness over your eyes. and it seems to strain, or you start rubbing your face more, and so it's
people
nice.
don't love the jowl, people don't love the chin, all of those things. Yes, I say every day, probably 65 times a day, the younger you start, the younger you stay. People that are trying to reverse time are having a much harder time. You really start young and you'll stay young. If you can start, in your 30s, 40s, 50s, it's much easier than if you start in your 60s, 70s, 80s, obviously. And so that's where you start to get that artificial look, is if you start too late, then we kind of have to plump things out artificially. But if we start young enough, we can just rebuild what we have.
Yes. Well, I like that. Right now I have the numbing lotion on, so I'm
she's
grateful.
Not greasy.
I did not get the numbing lotion when I did IPLs years ago, and that was really painful.
That's mean.
They gave me a cold thing and I
We're
put
much
it on.
nicer.
I didn't even know they did this, so I was so grateful when they said we're gonna put a numbing machine, because I was bracing myself thinking, oh my gosh, is it gonna hurt? But
I've had the Softwave, and what it feels like is a very hot needle that touches you, and just when you're like, that's too hot, it's done. And then it's like, that's too hot, and then it's done. And then there's no residual pain. So it is a very okay. We offer, she's driving, so we didn't offer this to her, but we do offer for patients, not only topical numbing, but you can have, a few medicines to help you relax called Xanax, as long as you have a driver. And we do also offer inhaled nitrate, laughing gas. And so it does make it very comfortable.
Oh.
Yeah, so we don't want people to be uncomfortable, and we want them to redo it. We want them to do it year after year. There's no need to do it once. We want you to come back year after year to get the lasting results that you want. Don't waste your money, like you said.
And it's nice that it's activating my own body's ability to repair or to rebuild, rather than taking something artificial.
Exactly. You want to look like yourself, not like somebody else. Like people with too much filler, they all look the same. It's like, we're not trying to do that. We're trying to enhance what you have and make you look great.
Yes.
Yeah. Well, awesome. Well, thank you very much. I'm so happy to watch your adventure and watch this journey with you. And so thank you very much for coming here. We appreciate it.
Thanks for the opportunity.
You
Thank
bet.
you.